Hello, welcome to Springer Nature's Q2 2022 Clinical Highlights meeting. We're happy to present to you the key titles list for medical books as selected by our editorial and sales team here at Springer Nature. All right, so to kick off the titles, the first is our title, Teaching Pearls in Non-Invasive Mechanical Ventilation. This book, Teaching Pearls, uses real-world clinical cases to analyze hot topics and provide insight into non-invasive mechanical ventilation, also known as NIV, by presenting a discussion of the topics in various scenarios of acute and chronic respiratory disorders and in intensive care patients. It demonstrates how these clinical cases can be used to teach residents or trainees about NIV. So, as the title mentions, the end of each chapter has pearls to summarize 5 key points or recommendations for takeaway, and each chapter also allows readers to develop a case-by-case understanding of NIV and what it is and how it functions. This is a great resource for students in postgraduate courses, for residents, trainees, and especially for professional conferences. And the next title we have is Oncocritical Care, an Evidence-Based Approach. Oncocritical care provides insights into the care of cancer patients in ICU in a comprehensive manner. By sharing an evidence-based approach, it helps readers to understand the critical care needs of patients suffering from malignancies. It discusses the evaluation and management of clinical issues comprehensively, which requires expertise in oncology, critical care, and palliative medicine. This is a useful book for residents, fellows, and trainees in the field of oncocritical care, oncosurgery, oncoanesthesia, as well as intensivists, critical care experts, and postgraduates in nursing. And our next title comes from the dentistry list. Toothware is now extensively revised in its 3rd edition with several new chapters. This book is an illustrated and authoritative reference on toothware and its management. Toothware, as we know, is becoming an increasing problem as people are beginning to live longer and keeping their teeth for longer. Recent surveys have shown that at least 75% of adults and more than 50% of children now have some form of identifiable toothware. This latest edition addresses this growing challenge by describing practical clinical techniques that will aid in the identification of erosion, attrition, and abrasion of the tooth, and by offering guidance in the planning and delivery of appropriate patient care for these issues. Readers will find helpful information on difficulties encountered in the diagnosis and prevention of tooth wear, problems associated with controlling the process, and strategies for providing management solutions. This is an essential guide for anyone in the field of dentistry and for dental students alike. And our next title is Management of Head and Neck Vascular Lesions. Since most vascular lesions occur in the head and neck area, surgical interventions present challenges with regard to facial growth, airway management, and reconstruction options. This book provides a simple step-by-step guide to the identification and sequential management of vascular lesions on the body. It also explores the treatment of head and neck vascular malformations and tumors from the perspective of various specialties, so it is interdisciplinary. Fields like ENTs, pediatric, maxillofacial, and plastic surgery are discussed in this book. And this one is written by leading international specialists and is a valuable resource for craniofacial, pediatric, maxillofacial, head and neck, and plastic surgeons, as well as pediatricians and otolaryngologists. And now over to Mart for our next title.
Quantifying Quality of Life will be published open access in April. The book presents the rise of technology-enabled methods and tools for objective quantitative assessment of quality of life, or QOL. This book fills a gap in the market as prior literature on the subject is fairly subjective and offers little contextual instructions for how to implement such assessments. This forthcoming title follows the WHO QOL model through which the World Health Organization outlines an individual's perception of their position in life in the context of the culture and and value system in which they live in relation to their goals, expectations, standards, and concerns. This book is an in depth resource describing and examining how to utilize state of the art, minimally obtrusive, and ubiquitous technologies. It highlights the required factors for adoption and scaling of technology, enabled assessment tools, and describes how these technologies can be leveraged for behavior change, disease prevention, health management, and improving the quality of life for the population at large. The audience for this title is large and includes physicians, physicians in training, software and hardware developers, computer scientists, data scientists, behavioral scientists, entrepreneurs, and healthcare leaders and administrators. Taking a settings approach to health promotion means addressing the context within which people live, work, and play, and making these the object of inquiry and intervention in both healthcare and promotion. The Handbook of Settings-Based Health Promotion provides academics, students, policymakers, and practitioners with unique insights into a wide variety of perspectives on settings-based health promotion. The book emphasizes how the creation of well-being in specific settings enables individuals and populations to flourish. From this lens, the setting is the entry point for health promotion. The book includes 15 chapters organized into 3 sections. Part 1, Evolution, Foundations, and Practicalities of the Setting-Based Approach, introduces the topic and key considerations. Part 2, Applying the Settings-Based Approach to Key Settings, introduces key settings, initiatives, and features. And Part 3, Gaia, the Ultimate Setting for Health Promotion, considers the settings approach in the context of future challenges. The book will be of interest across fields of health promotion and public health. Advances in Imaging is an updated resource covering all aspects of imaging technology and elaborating on the applications and advantages of each. It provides a step by step overview of advanced imaging modalities like molecular imaging, nanoimaging, robotic imaging, stem cell imaging, optical imaging, immunoimaging, and so on. The book includes the application of imaging tools in pathologies like oncology and infection, along with the available therapeutic options for treatment. Detailed overviews of more common imaging techniques are also included, such as ultrasound, CT, MRI, PET CT, and PET MRI, as well as detailed explanations of various radio tracers, biomarkers, and probes. The book is a valuable reference book for oncologists, hematologists, and surgeons alike. Contrast enhanced ultrasound is a clear, concise, richly illustrated, and comprehensive analysis of this imaging technology's use in the diagnosis of a wide variety of pathologies. Sonography reliably identifies a wide range of diseases, and the efficacy of modern ultrasound has dramatically improved with contrast enhancement. This book covers almost all aspects of contrast enhanced ultrasound, also referred to as CEUS, starting from basic principles and ending with features of its application in individual organs. In particular, it explores the diseases of abdominal, pelvic, and reproductive organs. Focal lesions are discussed in depth with attention to their early detection and differential diagnoses. The authors summarize their own experience with CEUS in oncology, hepatology, gynecology, urology, endocrinology, and other fields of medicine. This book will be a helpful tool for both residents and practitioners approaching ultrasound diagnostics.
The Very Old Critically Ill Patients is part of the European Society of Intensive Care Medicine textbook series, and it provides detailed, up-to-date information on the care of the critically ill very old patients, meaning 80 years or older, in the ICU. This age group is expanding quickly all over the world, which means that the numbers of patients in this group in hospitals and ICUs is increasing quickly also. A large part of this book is devoted to age-related changes in vital organ functions, as well as specific geriatric syndromes like frailty, cognitive decline, reduced activity of living, and others. The book is written jointly by intensivists and geriatricians, which is a new collaborative effort to improve care and rehabilitation and present a holistic view of the patients. This book should be beneficial to physicians and nurses and lead to a better understanding of this group's challenges and the ways caregivers can care for the patients in a way that respects life and prepares for end of life. The Handbook of Intravenous Fluids is an easy-to-use pocketbook covering all aspects of intravenous fluid therapy in critically ill patients, from applied physiology to bedside clinical management. The book is divided into 4 sections. First, a review of physiology, second, describing resuscitation agents, third, discussing fluid therapy and various clinical conditions, and the fourth, providing a rational approach to prescribing intravenous fluid. The chapters are organized in a consistent and accessible manner, beginning with a case study, followed by an explanation and clear recommendations, and it includes lots of graphics to facilitate understanding. So this book will be useful for students and all clinicians dealing with acutely ill patients. Mechanical ventilation from pathophysiology to clinical evidence gives a comprehensive overview of mechanical ventilation and the challenges involved in that process. Mechanical ventilation is a very significant and common practice in the treatment of critically ill patients, and it has become increasingly important due to the COVID-19 pandemic. Mechanical ventilation has two main approaches, physiology and protocols, and this book seeks to reconcile the two methods and give the reader guidance about when each approach is best. The book features a chapter on COVID-19 specifically as well, and other chapters on other relevant topics like mechanical ventilation in low resource settings. The book is addressed to physicians, nurses, and respiratory therapists. Novel Synthetic Drugs in Migraine is published in the series Headache, endorsed by the European Headache Federation, and this is the first book on the novel synthetic treatment of migraines with ditans like lasmiditan and gepants like atogepant, among others. These drugs provide additional options for people with migraines who have had side effects from other medications or who haven't had significant results from previous treatments. The book covers all aspects of these drugs and their role in migraine treatment, covering studies on clinical evidence, tolerability, and the different stages of clinical development. This is a very new topic, but there's sufficient literature published now on these drugs to interest a wide readership, including general physicians, general neurologists, clinical psychologists, neurologists in training, and medical students. And Cardiology Procedures is an extensively revised second edition. It's a compact reference work that describes a wide variety of diagnostic and therapeutic procedures performed by cardiologists. The focus in this book is on the clinical application of these procedures, with descriptions of their technical aspects as well as potential complications. The book provides detailed instruction on the interpretation of clinical data generated during these procedures. It includes case studies to illustrate how the data is used in clinical practice. So this is a high-level book designed to help in learning the diagnostic and therapeutic cardiology procedures performed in clinical practice, and it's also useful for trainees and practitioners in related disciplines. Oh, Jenny, you're muted.
Thank you. And over to our next title, Clinical Informatics Study Guide. This is an updated guide for those seeking to become certified in clinical informatics. This also includes physicians studying for the boards in clinical informatics, as well as anyone who's looking for the American Medical Informatics Association Health Informatics Certification. The content in this book has been extensively overhauled to introduce and define key concepts using examples drawn from real world experiences in order to cover all of the core content one needs to know in the field. The book groups chapters based on the major foci of the core content. So topics covered are healthcare delivery and policy, clinical decision making, information science and systems, data management and analytics, leadership in managing teams, and professionalism. The chapters do not need to be read in order or taught in order, although the editors have suggested that this is the curriculum that has been used over the course of teaching clinical informatics. This new edition further refines its place as a roadmap for faculty who wish to go further in courses designed for fellow physician fellows or graduate students in a variety of clinically oriented informatics disciplines such as nursing, dentistry, pharmacology, radiology, health administration, and public health. And the next title we have is Clinical Ethics Handbook for Nurses. So nurses working in acute and chronic settings face many obstacles for providing good care and are often the first line of defense related to patient safety and meeting the needs of patients and their families. Some of the obstacles include sociocultural issues as well as inadequate communication, but a lot of the time it is institutional. The evidence points to the idea that while nurses do have the knowledge and skills to address practice problems of various sorts, they may not be confident in their skills of ethical decision making and advocacy actions. So, the Clinical Ethics Handbook for Nurses provides tools to nurse educators, ethics educators, and practicing nurses and allied health professionals to develop the confidence and skill in ethical decision making in interdisciplinary settings such as acute and chronic care hospitals or clinics. This is a useful guide and handbook for all healthcare professionals who face those ethical issues in the course of their work and who work with nurses to resolve these issues. And our next title is Neonatal Nursing. This textbook is written in line with the Council of International Neonatal Nurses and their vision for global unity of neonatal nursing. The core values and goals of the Council are based on excellency and advocacy for high quality newborn care, as well as respecting diversity by integrating global perspectives on cultural norms and values among care of newborns and their families. This book promotes neonatal nursing as specialty through evidence, research, and education of neonatal nurses, and elaborates on key topics for neonatal nursing across the globe. Items such as continuity of neonatal care in the community, patient and family-centered care in the neonatal settings, sleep and brain development, the fundamental care needs of neonates and families, and then a global perspective on hypothermia, hypoglycemia, and hypoxia. This textbook is a great resource for bedside nurses, advanced practice nurses, midwives, and allied professionals. Principles in nursing practice in the era of COVID-19. So, the COVID-19 virus has progressed rapidly, causing substantial disruption on a global scale, never before seen in our lifetimes. And caring for patients has proven especially challenging due to the rapid growth of research and the ever evolving data that has come with the discovery of the disease. As nurses caring for these critically ill patients, discerning as nurses caring uh, as nurses continue to care for critically ill patients, discerning good evidence-driven data from the masses can be overwhelming, and integrating it into current guidelines can be challenging as well. This guide provides a summary of key nursing practices and established guidelines necessary to provide care to the spectrum of patients with COVID-19. Experts in the field offer concise and relevant information to fill current knowledge gaps. This book is meant as a practical nursing guide for both the inpatient and outpatient settings, as well as the adult and pediatric populations. So this is certainly a foundational guide to to establishing a pathway of care for patients with COVID-19. Our next title is The Principles of Virtual Orthopedic Assessment. So this book fills a gap in the literature. It's a concise and practical book that presents the principles of virtual orthopedic assessment and shares insights into the use of technology for telemedicine. The book offers expert know-how and best practices and equips readers with essential information on how to best remotely manage a diagnosis, the treatment, and the follow-ups of patients. Chapters focus on a specific joint or compartment. It highlights peculiarities in terms of remote clinical assessment and also touches on the tech, which is in the data security, patient confidentiality, and consent, as well as medical legal issues. This book covers all of the basic principles and practical aspects of this emerging field. It is a must read for any orthopedists and other professionals, such as general practitioners, physiotherapists, wanting to gain insight into remote orthopedic care. All right, and over to the next title with Marit.
Assembled for practicing plastic surgeons, the Atlas of Whole Body Contouring presents current and proven strategies and techniques for body contouring in plastic and reconstructive surgery, and addresses the issues that surgeons often don't have the luxury of long learning curves to work from when operating. The topics presented in this atlas have been carefully selected to avoid redundancies, and where there is more than one surgical option to choose from, expert contributors present the technique that has been most broadly accepted as the procedure of choice. The easily accessible information will guide surgeons in their daily practice, helping them minimize complications and achieve consistent results. The book also presents a number of complicated cases. The book includes descriptive figures and high quality illustrations throughout. When Words Betray Us presents a journey into how language is put together for speaking and understanding and how it can come apart when there is an injury to the brain. This book answers the question of how the brain analyzes the pieces of language, sounds, words, and meaning, and ultimately puts them together. Aphasia is the loss of ability to understand or express speech caused by brain damage. This important medical title provides background on this disorder using neuroimaging to provide a state of the art portrayal of language and brain function. Consideration is given to whether language can recover after brain injury. This book is clearly written for interested readers, and no prior knowledge of linguistics, psychology, computer science, or neuroscience is required for understanding. Written in collaboration with ESCA, which stands for the European Society of Sports Traumatology, Knee Surgery, and Arthroscopy, Epidemiology of Injuries in Sports is authored by almost 100 international experts sharing the belief that prevention is the first mission of sports medicine. This concise yet comprehensive book covers the epidemiology of injuries in 24 different sports. Common sports include soccer, volleyball, and track, while more obscure sports include archery and race car driving. In each case, the authors present and analyze the sport's main characteristics, the physiological and biomechanical demands on athletes, the epidemiology of common injuries, as well as prevention strategies and rehabilitation techniques to ensure a return to play. Based on an updated overview of sports specific data, this book equips the reader with a solid understanding of sports injuries, stressing the implementation of preventative measures. This is an excellent source of knowledge for sports physicians, researchers, residents, fellows, and trainers alike. Hypospadias repair is surgery to correct a defect in the opening of the penis that is present at birth when the urethra does not end where it should. Now, a second edition, Hypospadias Surgery is a well received illustrated textbook that reflects the state of the art techniques in this common surgery. It provides a comprehensive reference that covers the history, embryology, anatomy, morphology, pathogenesis, epidemiology, genetics, all surgical techniques, their complications, and long term follow up related to this procedure. Um, the book includes more than 2,000 color illustrations, operative photographs, surgical tips and tricks, and complications. Hypospadias surgery has become a true subspecialty with diversity of opinions and a large number of operations to choose from. In this unique volume, a team of world-class authors, 42 experts from 19 countries, presents a professional and updated global overview on the management of this condition, highlighting and exploring the current philosophy and the different principles and techniques of hypospadias repair. This is a practical guide not only to surgeons in training, but also to more expert surgeons involved in the management of this common but troublesome condition. Pediatric urologists, pediatric surgeons, plastic surgeons, and urologists will benefit from reading this second edition.
Modern hip preservation comprehensively discusses both the history and the current concepts of modern hip preservation surgery. It offers an overview of the game-changing studies on the hip and pelvis vascular anatomy, describing the evolution of a new perspective of hip joint degeneration and other key hip conditions. It also examines the main surgical procedures that have evolved and matured since the 1980s, culminating in a new class of open surgical approaches such as hip surgical dislocation and others. This book is based on over 40 years of practical and pioneering experience by the editor, and this book offers a valuable resource to residents, researchers, and practicing orthopedic surgeons wishing to gain insights into hip preservation surgery. The Foot is a new edition of a highly illustrated book on a wide range of foot conditions, guiding the reader on the rational pathway from a clinical examination through radiological screening to appropriate surgical solutions. Each condition described includes a thorough explanation of proposed treatments and follow-up results. A key feature of this book is the focus on systematic description. The treatment-related chapters include numerous references to earlier parts of the book in order to clearly link the preoperative evaluation to the treatment. The treatments and follow-ups are often complex, so this systematic approach ensures understanding and takes all possible challenges and outcomes into account. This new edition includes updated guidance on clinical examination, a series of case studies demonstrating the composite approach to complex reconstructions, and detailed coverage of the treatment of diabetic arthropathy. The textbook of Polytrauma Management is a fully updated and revised third edition of a highly successful textbook. It's a practical guide to the care of the polytrauma patient. Broadening its readership to students, this new edition comprehensively describes the clinical course of treating multiple and severe injuries from the accident scene to rehabilitation. The book provides essential practical information on the care of patients both with blunt and penetrating trauma to multiple body regions, and discusses the management of truncal injuries, meaning head, chest, and abdomen, as well as fractures of the extremities, pelvis, and spine. This new revised edition takes full account of recent developments, including the increasing economic pressure on healthcare systems, pre-hospital treatment, changes in trauma systems and related education, and the improved survival of polytrauma patients. This work will greatly assist students, emergency personnel, trauma surgeons, orthopedic traumatologists, and anesthesiologists. Senior Trauma Patients describes the management of elderly patients who are at risk of or suffer physical trauma, drawing on up-to-date knowledge from multiple specialties, as the number and severity of comorbidities in this age population requires expertise in many fields. Readers will find comprehensive and detailed coverage of the prevention of complications related to aging, geriatric care concepts, specific treatments in acute care, including fracture stabilization and diagnostic procedures, and the surgical management of different types of fracture and soft tissue trauma. Intensive care management of the geriatric patient is also extensively addressed. The authors here are a group of renowned experts from each of the relevant fields, and the book will be a valuable asset for surgeons, intensivists, geriatricians, gerontologists, and rehabilitation specialists.
All right, thank you so much. And to round out our list, we have 3 veterinary medicine titles that we want to present to you today. The first is Health and Welfare of Captive Reptiles. This is in its second edition. It's extensively revised, and there are 9 new chapters. So the new edition offers concepts, principles, and applied information that relates to the well-being of reptiles and meeting their biological needs. Also discussed are the positive and negative implications of general husbandry and the research programs that are part of reptile welfare. In addition to the content discussed, there are the 9 new chapters as mentioned. It includes sensory systems, social behavior, brain and cognition, control deprivation and enrichment, effects of captivity, imposed noise and light disturbance on welfare, spatial and thermal factors as well. The authors of the book have adopted a user-friendly writing style to accommodate the book to a broader audience, but it is primarily aimed at academic professionals. And this is a comprehensive biology book, so it will inform all of those professionals involved in captive reptile husbandry. And the next title we have is Management of Animals in Disasters. This is a comprehensive guide for veterinary and humanitarian professionals to plan emergency responses for the care and welfare of animals. It highlights different principles and approaches and the guidelines related to the rescue, relief, and management of animals during disasters from the perspective of saving both livestock and wild animals. It covers various topics on disasters, such as principles of disaster management, operation planning, team deployment, and it also discusses the importance of early warning systems, biosecurity, techniques for data collection, a One Health approach, and touches on climate change and the appropriate strategies for mitigating effects. This is an essential guide for veterinarians, humanitarian workers, farmers, disaster response force personnel, and also anyone involved during various types of disaster and emergencies. And the last title we have is Non-Human Primate Welfare. Since humans began keeping non-human primates, we have made vast strides in understanding their cognitive abilities, their strong social bonds, their vibrant personalities, and their capacity for joy and suffering. And with an increasing number of countries banning the use of great apes in biomedical research, the welfare of non-human primates in zoos and research facilities has gained increasing attention. The book reviews the welfare of primates under human care. Chapters detail the history of primates in captivity, ethical and legal issues surrounding the use of non-human primates in entertainment or in research. Different approaches that welfare is measured are housing, enrichment, and other conditions that can foster or degrade non-human primate care. Readers from animal welfare science, primatology, animal testing, veterinary medicine, conservation ethics, and legislators will also find value in this book. And that is our Q2 2022 clinical medicine list and highlights. We hope we found this helpful. And if you have any questions, feel free to reach out to the contact on the slide. Thank you.